Well, I've spent the last year almost working with a PI at Texas Children's Hospital, and he's on one of the ethics committees there. And so the focus of a lot of my practicum experience has been in medical ethics, and I've been looking at how ethics committees may be contributing to or recreating some of the disparities that we see in infant health disparities and in pediatric health disparities overall. Like it's like very well known that like Black and Hispanic and minority populations do tend to face like worse health outcomes or worse clinical encounters, and so that was something that I wanted to really like unpack in my practical experience. We actually found out that they weren't the ones that were the overrepresented groups. Asian American groups and Asians in general, as a racial group, were overrepresented in ethics committee consultations at Texas Children's, which was a really interesting finding because. Having done some new research into that, we found that there's actually really no research on ethics and like the relation between that and Asian Americans. And like even the implicit attitude test that Harvard uses, there's been so many studies about how providers may have biases against African Americans or Hispanic Americans, but there's been no, as far as I know, tests or studies that have looked at how implicit biases against Asian Americans affect providers. And so I think that was a really interesting finding for us because it wasn't something we were focused on, but like it really did reveal like a very unmet need.